Top Med Talk.
Hello, my name's Nick Majerison and welcome to Top Med Talk Digest. Here is a highlight taken from a recent conversation under the title The Brain Health Initiative. It features Dr. Carol Peden, Professor of Anesthesiology at the University of Southern California and also Vice Chair of the Perioperative Brain Health Initiative. She and Dr. Lee Fleisher, the Chair of Anesthesiology at the University of Pennsylvania and the Chair of the Perioperative Brain Health Initiative, get around the table with Desiree Chappell and talk about consent in anesthesiology. We're also talking about how exercise improves brain health towards the end. It's a fascinating little clip. Have a listen and don't forget the full conversation available on the podcast feed. All you need to do is look on your podcatcher or on the website for the Brain Health Initiative.
When I ask people, are they actually consenting people from an anesthetics standpoint about the risks of postoperative delirium and cognitive changes, they're not. I mean, maybe 20 to 30%. We've actually seen an uptick, and people aren't sure how to do it. So that's one of the advantages of having AARP and others is they can help us tell the story so that we don't scare the patient. The other thing is, should we be including this as an outcome of our trials? We have not usually included any assessment of delirium or cognitive function after surgery. We need the Deb Culleys of the world, Stacy Diener, who's another member of our team, to actually start including it in trials that are ongoing. And in fact, Mark Newman, who is running the large-scale PCORI grant on hip fractures of regional versus general, includes it in the trial. But I think if this trial had happened 5 years ago, 7 years ago, it wouldn't have been an important outcome. So I think it's interesting as we go to patient-reported outcomes, people care about it.
Well, I mean, I think that the way we start working on those assessment tools is, again, starting with the patients. Because, I mean, if you can talk to them, talk to your family, you know, how do we know when they're showing signs of issues and things like that we can't necessarily pick up on as a provider if you've only met a person one time or taken care of them.
Well, there's some very simple tests that can be done, again, coming mainly from Deb Cully's group, but many of the other researchers as well, showing, you know, simple things like drawing a clock face and remembering a few words can show that potentially this patient is vulnerable. It's not a diagnosis, but it shows vulnerability that should be very carefully thought about when planning the procedure.
So the interesting question is this idea of informed consent or educating the patient and the provider. And it'll be very interesting when we get together about how we create that material. And even the college, the American College of Surgeons, doesn't have materials yet. And, you know, we're used to talking about medical outcomes that are very clear to us, particularly in the anesthesia sphere and I think in the surgical sphere. And that idea of how much, you know, if we said to a patient, when you go home, you should worry about what happens long term, and maybe be sure that your daughter or son or grandchildren are there for more than 1 or 2 days, or that you have neighbors come in before you leave. That should be part of this shared decision-making informed consent. I recommend people, if they Google Rita Redberg and Kaiser Health News, that there's a story, and Rita is one of the leaders in Choosing Wisely. She's the editor of JAMA Internal Medicine, and she tells the story of her 95-year-old mother and how aggressive people want to be with her, but her mother doesn't want to be that aggressive. So if you included what the potential effect on cognition if somebody is really frail and deteriorating, they may not choose to be as aggressive if one of the outcomes is a lack of independence or even a worse, even if it's for 3 months, but if you're 95, that's different than if you're 60.
Yeah.
So,
well, Dr. Peden, are you talking how are you talking to your patients about this? And actually, have you changed patients' minds because of this information that you're giving them?
I think having very informed conversations. I've certainly had discussions with patients where everything put together, and going back to the surgeon and saying, you know, are there other options, has changed a patient's mind. I think going back to your point about enhanced recovery, where this fits in is if you think about the whole patient journey in enhanced recovery, where you've got the patient and the family very involved in the decision-making, informed about the goals and what's going to happen on each day, and also the early mobilization, drinking, eating, all those things are going to be helpful. We don't have evidence yet that they make a difference, but it seems like it's going to be helpful. And we should be thinking about that. We know from the work I've done with elderly emergency patients, when you put them on these very standardized pathways, they do well. So including this in enhanced recovery, I think is very important.
And I think exercise is one of the few things that improves brain health. We don't know if it improves perioperative brain health, but if we're going to do prehabilitation research, this has to be one of the outcomes, because it may actually improve someone's drive, because they may say, well, I won't do it for my heart, but I might do it for my head.
Top Med Talk.
You're listening to Top Med Talk. Don't forget to subscribe to our podcast. topmedtalk.com is the website. Don't forget, Top Med Talk will be live from the EBPOM USA Masters course on the 10th of April, a perioperative care practicum in Atlanta. Make sure you join us and check out our website for details of how we're streaming some of the events live from the course, www.topmedtalk.com.